All right, guys, let's get busy talking about teratogenic medications. When it comes to these medications, we are going to be expecting the majority of birth defects and errors to occur during weeks 3 to 8. And this is because this is the period during development when our organs are developing and we're having a lot of rapid cell division. And so these medications are going to have their effects, especially during this time of pregnancy. So let's start our discussion by talking about our ACE inhibitors. And ACE inhibitors usually end in the suffix pril. Lisinopril is a great example of an ACE inhibitor. These are going to lead to fetal kidney damage, and sometimes this damage can be so intense that it even leads to renal agenesis, which means absence of a kidney. So we can have absence of one or both kidneys, or we can just have kidneys that are rather impaired. And this kidney impairment is going to lead to a decrease in the production of amniotic fluid in the kidneys. So when it comes to kidney damage, we're going to have reduced amniotic fluid or reduced fetal urine output, and so we're going to have oligohydramnios, which is a fancy word for reduced amniotic fluid. And this can lead to something called Potter's syndrome. And Potter's syndrome occurs when we don't have enough amniotic fluid in the womb. And what happens is the fetus kind of gets crushed. So you can expect them to have a flat face or limbs that are clubbed and not fully developed. And this is because they don't have room to grow because there is no amniotic fluid for them to grow. Next, let's talk about a really high yield type of birth defects, and that's going to be neural tube defects. And this is going to particularly happen with our anti-epileptic medications like carbamazepine, valproate, and phenytoin, as well as with folate antagonists, namely methotrexate. So what's going to happen here is that we're going to get neural tube defects because folic acid is very important during neural tube formation. And so if we do not have adequate amounts of folic acid because these drugs are antagonizing folic acid, we are going to get neural tube defects. So let's take a look at kind of what this looks like here. So here in this drawing, we have a patient, this is the fetus, who is going to have varying levels of neural tube defect. So let's kind of go through some of these. So here up in the top area, we have anencephaly. So this blue portion is representing the brain and the overlying skull and skin. Without proper folic acid, this becomes exposed, and this is going to be largely lethal within utero or shortly after birth. Additionally, we can have two other types of neural tube defects, which I'm going to highlight here. So this green portion is representing our meninges. And so when it is just the meninges that are exposed, like we have here, we're going to call this a meningocele. Whereas when we have both the meninges and the CNS, which is represented in blue, we're going to call this a myelomeningocele. And both of these are forms of spina bifida. And spina bifida is when we have failure of neural tube closure down in the more caudal regions of the central nervous system, whereas in the cranial regions, we call this anencephaly. Next, let's talk about our fluoroquinolones. So these are known to cause cartilage damage in our babies, and this is easy to remember because this can also happen in our elderly patients as well. We can get cartilage and tendon rupture in these patients, so just be aware that fluoroquinolones can cause this in both elderly and in our babies. Let's move on to talk about our tetracyclines, and these are going to cause darkened or discolored teeth. So I'm using this dark brown ugly tooth color, and it's also going to cause decreased bone growth. Our next drug on the list is going to be chloramphenicol, and chloramphenicol is going to be metabolized by liver enzymes, and our liver is not fully developed in our developing fetus, so they do not have the adequate liver enzymes to deal with the burden of chloramphenicol which the mother may be taking. And so this is going to lead to something called gray baby syndrome, and this baby is going to have a dusky gray appearance because they do not have the liver enzymes necessary to metabolize this drug, and it can also present with abdominal distension as well as cardiovascular collapse in the fetus and can be quite deadly in some cases. Next on our list is going to be NSAIDs, and NSAIDs are going to cause premature closure of the ductus arteriosus. And you may be asking, wow, the ductus arteriosus is like a very advanced late stage structure in pregnancy, and you're absolutely right. So the special thing about NSAIDs here is that this is going to occur more in the second and third trimester, where NSAIDs are wanting to be avoided because they're going to cause this vasoconstriction that is going to close the ductus arteriosus. And it may help you to remember indomethacin, which we use to close the ductus arteriosus when it has stayed open long after it is supposed to. Next, let's talk about methimazole, which is going to be a thyroid medication that causes aplasia cutis. And aplasia cutis is going to be absence of skin over the underlying bone. This is most commonly going to be seen on the skull and scalp scalp, so you will see a big absence of skin over the skull, and that's characteristic of aplasia cutis due to methimazole. The next drug we're going to discuss, lithium, is particularly high yield. It can cause Ebstein's anomaly, which is going to be a defect in the developing heart. So let's take a look at it because they love to talk about the specific description here. So in our normal heart, here is our right atrium, and then here is our right ventricle. This is what it looks like in a normal heart. When patients are exposed to lithium in utero, they get what we call atrialization of the right ventricle. So this atrium is going to grow really, really big, and this sometimes is also described as downward pushing of the tricuspid valve into the ventricle. So you'll see we're left with this really tiny ventricle, so you want to be on the lookout for hot words like lithium, tricuspid valve displacement, or atrialization of the ventricle. These are all describing Ebstein's anomaly. Next on our list is going to be thalidomide, which was a drug that was prescribed for morning sickness way back in the early 1900s for pregnancy. We do not use this anymore because it causes limb defects. Step 1 still likes to ask about this, and so the way I like to remember it is I like to think of it as thalidomide. So it causes limb defects because it kind of sounds like limb in the name. That's how I remember this one. Our last prescribed medication is going to be tretinoin, which causes vitamin A toxicity. Tretinoin is a form of vitamin A that we use for acne that is refractory to other treatments, and this is going to be usually taken by teenagers who may not be aware of like contraception and might get pregnant on accident. And so it's important that you are screening and test questions for patients that may be on acne treatment and may be at risk for getting pregnant, especially if it's unintentional. And unfortunately, this can lead to the risk of spontaneous abortion, and this is a really, really dangerous drug to the fetus. Let's move on now to talk about some of our non-prescribed drugs that can cause teratogenic defects, specifically some recreational drugs, starting off with alcohol. Let's talk about fetal alcohol syndrome. So this is going to present as a young child with intellectual disability, as well as some characteristic physical exam findings. Those exam findings are going to be a thin upper lip, a flat philtrum, as well as down slanting palpebral fissures. So let's go ahead and take a look at this in our picture off to the right, where we see some characteristic facial characteristics. So we're going to see small eye openings. You can see this child has like really kind of tiny eyes, and then a smooth philtrum. That's going to be really high yield. So the philtrum is this kind of depression that we normally have in our lip, and you can see that this child has absent. It's almost as if his lip is a little hill. And then additionally, they're going to have a really thin upper lip as well. So it's important to be able to like recognize this face because you may get a picture of it on exam day, as well as be able to recognize the language that describes this face. The diagnosis is going to be clinical because it's just noting intellectual disability as well as these characteristic features in the setting of a patient who may have had alcohol during pregnancy. Some additional features that you may see is holoprosencephaly, which is going to be when the frontal lobe is just one giant piece. It's not split into two as it normally should. And we can also see ventricular septal defects, also known as VSD. And what happens here is we have failure of migration of neural crest cells, which we talked about in our last video, and they fail to migrate to this area that I'm kind of making a box right here. And this is the endocardial cushions that are formed from these neural crest cells, and they fail to migrate properly, and so we get a VSD. Next, let's talk about cocaine and cigarettes, which are both going to cause vasoconstriction on a widespread scale. And when we have vasoconstriction, our placenta does not get the blood supply it needs, and so it's going to slough off prematurely, and this is called placental abruption, and this is very concerning, and this is why we do not want our patients to be taking anything that can cause severe vasoconstriction like smoking or cocaine. Additionally, carbon monoxide exposure can cause hypoxia for our fetus because carbon monoxide is going to outcompete oxygen for binding on hemoglobin, leading to this hypoxic state. Let's wrap up by talking about opioid exposure, which is going to lead to neonatal abstinence syndrome, and this is going to present as a baby with an uncoordinated suckling response, as well as a high-pitched cry and sneezing. And I would say that sneezing is the highest yield one here. If you hear a baby that is sneezing or you read about it on test day, that is pointing you towards neonatal abstinence syndrome. In terms of managing these patients, we're going to go ahead and treat them with opioids. We can use full agonists, or we can use partial agonist antagonists. So our full agonists are going to be methadone and morphine, whereas our partial agonist, partial antagonist is going to be buprenorphine. And that is it for our teratogen content.